Hey everybody, my name is Dr. Scott Giacomucci. I'm a trauma therapist and educator in the Philadelphia area. And in this video, I want to talk about why trauma healing can sometimes feel worse before things start to feel better. This is a common theme that I notice in the clients that I work with and the trauma groups that I lead, that the process of engaging in trauma therapy is uncomfortable. It's difficult. It's even painful. It challenges us to look at some of the most difficult experiences we've had in our life, to open up old memories that we've avoided. And many clients feel like they're regressing, that they're not making progress, or that their symptoms are getting worse, their feelings are getting worse, and they wonder if it's even makes sense to be in therapy or even makes sense to do trauma work. So if the healing is making things feel worse, it does not necessarily mean that we're doing anything wrong. It's kind of a paradox that trauma healing means facing the things that we've avoided. It means feeling the pain and the rage and the fear and the shame and the guilt and the sadness that we've avoided feeling. The suppression of these feelings and memories may have allowed us to function, but the healing usually requires bringing these things to the surface. And so in the initial phases of trauma therapy, as we start to tap into these painful memories and sensations and emotions, it makes sense that we might feel destabilized at first. It makes sense that things might feel like they're getting worse, or the symptoms might feel like they're intensifying. This is pretty common in the initial phases of trauma therapy. The PTSD or complex PTSD symptoms may actually increase before they decrease. This happens so often that in my ongoing weekly trauma group, that every week I remind clients that this might happen. And so if they're noticing increased symptoms, increased flashbacks, increased negative feelings, increased negative beliefs, that this is common, and that the symptoms almost always decrease after the first couple weeks or so. So in trauma therapy, our nervous system is learning to process instead of suppress. And it makes sense that this is going to be an uncomfortable process. It makes sense that things might feel like they're getting worse before they feel like they're getting better. I also want to highlight that how we're feeling isn't always the best indicator of how we're doing, but how we're feeling isn't always the best indicator of outcomes in therapy. That therapy isn't designed to just make us feel better. Therapy is also designed to work on other outcomes, like how we're doing, or our sense of self, or a sense of meaning or purpose in the world. And that these are often correlated with also feeling better. But sometimes it requires us to face some pretty painful truths. And although we may be progressing and growing in some ways, at the same time, we might not be feeling better. Before we go any further in the video, I want to share a quick message with you. I want you to know that we see people heal from trauma every day, and we believe that this is possible for you too. No matter what you've been through or what you've experienced, there is hope for healing. And there are caring professionals that are able to help you. At the Phoenix Center for Experiential Trauma Therapy, we specialize in helping individuals move beyond trauma, grief, and difficult life experiences. We provide in-person therapy in Media, Pennsylvania, near Philadelphia, or online therapy for those in Pennsylvania, New Jersey, and Delaware. We also offer online trauma recovery coaching and professional consultation for clients and professionals around the world. If we aren't a good fit for what you're looking for, we might be able to offer you some suggestions of other trusted colleagues that you could work with. You don't have to try to deal with the trauma or grief alone. Learn more about our services, fees, and therapists on our website, where you can also schedule a free intake call and start your trauma therapy or recovery coaching journey with us. All right, back to the video. Trauma therapy challenges our relationship dynamics. And our relationships may naturally start to change what we prioritize in relationships. The types of relationships we want to be in, the types of relationships that we're cultivating may start to change. And this could impact the people that we are in relationship with, which could also impact how they're feeling and how we're feeling. And this is all pretty normal. It's kind of like a healing crisis, but there's a temporary increase in distress before healing and reprocessing and integration. One metaphor for understanding this is thinking about a physical wound that some people say, just rip the Band-Aid off already. Kind of understanding that there's going to be an initial discomfort or sting before we can really heal the wound. Another way of thinking about it is that the old wound has been festering and maybe it is infected, and that we need to clean it out before it can heal. And the process of cleaning out an old wound is uncomfortable and painful, but it's necessary in order for that wound to heal and for that infection to prevent it from spreading to other parts of the body. And so this is a way we could reframe it and think about it, that the discomfort that comes with trauma therapy and trauma healing isn't failure, it's part of the process. And with safety and support and coping skills, this intensity really lessens over time. So healing really is not linear. Sometimes it hurts more before it helps. And that's okay. That's understandable. That's even expected in trauma therapy. So if you're just beginning trauma therapy and you're feeling like things have gotten worse, I really encourage you to hang in there. This is pretty common, pretty typical. It is not a reason to end therapy. And even if you're midway through trauma therapy and you're getting into trauma processing, pretty common for things to feel like they're getting worse as you dive into the deeper parts of trauma therapy. Again, this is not a reason to give up or to feel like the trauma therapy is making things worse. This is often part of the process of trauma work, no matter what the modality is, that things start to get tough or we start to feel like things are getting worse before they get better. Really encourage you to stick with it, to see it out to the end, to talk to your therapist about it, to get their perspective, their feedback, and to know that things often get worse before they get better. And I really hope that this video provides some reassurance, some encouragement, not to give up on therapy, not to give up on trauma healing, and not to give up on yourself. If you did find this video helpful, I encourage you to subscribe to our channel here. And if you've been in this situation of considering giving up on therapy, considering giving up on trauma healing, I encourage you to write in the comments, what was it exactly that gave you the motivation to continue, even when it felt like it was getting worse or it felt like the symptoms were increasing because of the healing? Share with us what you found helpful. You might just save someone's life or encourage someone to not give up on their own process of healing.